Welcome back to Calm Mind and Healthy Body, our channel. In today's video, we're exploring a topic that affects millions of people worldwide: heart health. Specifically, we'll discuss medications that can lead to heart failure, the critical signs of a heart attack, and the concerning issue of blocked arteries in the legs. Understanding these elements is essential for maintaining a healthy lifestyle and preventing serious health complications. First, let's talk about medications. While many prescriptions are designed to improve our health, some can have unintended consequences, particularly concerning heart health. Certain medications, such as some anti-inflammatory drugs, certain diabetes medications, and even some cancer treatments, have been linked to an increased risk of heart failure. Awareness of these risks is crucial, especially if you or a loved one takes these medications. Always consult your healthcare provider about the potential side effects and weigh the benefits against the risks. Now, recognizing the early signs of heart issues can be a lifesaver. Symptoms like chest pain, shortness of breath, and unusual fatigue should never be ignored. These signs can indicate a heart attack, which is a medical emergency. Additionally, seeking immediate medical attention is vital if you experience discomfort in your arms, back, neck, or jaw. The sooner you act, the better your chances of recovery. Moreover, let's not overlook the importance of peripheral artery disease, which can lead to blocked leg arteries. This condition often goes unnoticed until it becomes severe, leading to pain, cramping, or even mobility issues. If you find yourself experiencing leg pain during physical activity, it's essential to consult a healthcare professional. Heart health is not just a concern for those with existing conditions, it's relevant to everyone. Making informed choices about medications, recognizing the signs of heart issues, and understanding the risks associated with blocked arteries can significantly impact your quality of life. By prioritizing heart health, you're investing in your overall well-being. So, stay tuned as we explore these topics in more detail, providing you with the knowledge you need to take charge of your heart health. Remember, being proactive today can lead to a healthier tomorrow. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Alert! 6. Common medications that can cause serious heart failure. This segment examines 6 common medications linked to severe heart failure risks. While these drugs can be essential for treating various conditions, it's crucial to understand their potential side effects, especially concerning heart health. Let's examine each medication and its implications. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. Commonly used for pain relief and inflammation, NSAIDs like ibuprofen and naproxen can lead to fluid retention and increased blood pressure. Over time, this can strain the heart and potentially lead to heart failure, particularly in individuals with pre-existing heart conditions. 2. Certain diabetes medications. Some medications used to manage diabetes, such as thiazolidinediones, like pioglitazone, have been associated with an increased risk of heart failure. These drugs can cause fluid retention and weight gain, which can exacerbate heart problems. Patients need to monitor their heart health while on these medications. 3. Chemotherapy. Agents. Certain cancer treatments, particularly anthracyclines like doxorubicin, are known to be cardiotoxic. They can damage heart muscle cells, leading to heart failure. Patients undergoing chemotherapy should have regular heart function assessments to catch any issues early. 4. Antidepressants. Some selective serotonin reuptake inhibitors, SSRIs, and other antidepressants can affect heart rhythm and blood pressure. While they are crucial for mental health, it's important to discuss any cardiovascular risks with your healthcare provider, especially if you have a history of heart disease. 5. Corticosteroids. Medications like prednisone are often prescribed for inflammatory conditions. However, long-term use can lead to weight gain, hypertension, and increased blood sugar levels, all of which can contribute to heart failure. Regular monitoring is essential for those on corticosteroids. 6. Certain antihypertensives. While many blood pressure medications are beneficial, some, like beta blockers, can have side effects that may lead to heart failure in specific populations. Working closely with a healthcare provider is vital to finding the proper medication that balances blood pressure control with heart health. Understanding the potential risks of these medications is crucial for anyone taking them. If you're prescribed any of these drugs, it's essential to have an open dialogue with your healthcare provider about your heart health. They can help you weigh the benefits against the risks and monitor your condition effectively. Remember, being proactive about your health can make all the difference in preventing severe complications. Stay informed and take charge of your heart health. 6. Signs you'll have a heart attack in 1 month. This critical segment will discuss 6 warning signs indicating an impending heart attack. Recognizing these signs early can be crucial for your health and well-being. Let's break down each sign, examples, and symptoms to watch for. 1. Chest discomfort. One of the most common signs of a heart attack is chest discomfort. This can feel like pressure, squeezing, fullness, or pain in the center or left side of the chest. It may last for more than a few minutes or go away and come back. If you experience this sensation, especially if other symptoms accompany it, don't ignore it. 2. Shortness of breath. It could be a warning sign if you are usually short of breath during everyday activities or even at rest. This symptom can occur with or without chest discomfort. For instance, if you can only climb stairs or perform light activities after feeling winded, it's time to consult a healthcare professional. 3. Radiating pain. Pain that radiates to other body areas, such as the arms, back, neck, jaw, or stomach, can be a significant indicator of a heart attack. For example, you might feel a sudden pain in your left arm or an unusual tightness in your jaw. These sensations should not be taken lightly. 4. Nausea or lightheadedness. Feeling nauseous or lightheaded can also signal a heart attack, particularly in women. You might experience an upset stomach or feel faint, which can be mistaken for other issues. If these feelings are persistent and accompanied by other signs, seek medical attention immediately. 5. Unusual fatigue. Extreme fatigue that is not typical for you can be a warning sign, especially if it lasts several days. This fatigue may feel overwhelming and can occur even without physical exertion. If you find yourself unusually tired and affecting your daily life, it's worth discussing with your doctor. 6. Sweating. Breaking out in a cold sweat without apparent reason can signify a heart attack. This may feel like a sudden onset of sweat, often described as clammy skin. If you experience this along with other symptoms, it's crucial to act quickly. Early detection and response are vital in heart health. Don't hesitate to seek medical attention if you notice these signs. Time is of the essence, and acting quickly can save your life. Remember, it's always better to be safe and get checked out than to ignore potential warning signs. Stay vigilant and prioritize your heart health. 6. Warning signs of blocked heart. Arteries and legs. In this segment, we're focusing on 6 warning signs that may indicate blocked arteries in the legs, a condition known as peripheral artery disease, PAD. Recognizing these symptoms is crucial for maintaining heart health and preventing serious complications. Let's explore each symptom and its significance. 1. Leg pain or cramping. One of the most common symptoms of blocked arteries in the legs is pain or cramping during physical activities, such as walking or climbing stairs. This discomfort, often called claudication, occurs because the muscles don't receive enough blood flow. If you notice this pain subsiding with rest, it's a significant indicator that you should seek medical advice. 2. Weak or absent. Pulse in the legs. A weak or absent pulse in the legs or feet can signal reduced blood flow due to blocked arteries. This significant symptom indicates that your circulatory system is not functioning optimally. If you can't feel a pulse in your legs, it's essential to consult a healthcare provider promptly. 3. Numbness or weakness. Experiencing numbness or weakness in the legs can also suggest blocked arteries. This sensation may feel like a tingling or a loss of feeling, particularly after physical activity. Ignoring the symptom can lead to further complications, including severe pain or even tissue damage. 4. Coldness in the lower leg or foot. If one leg or foot feels noticeably colder than the other, it may indicate poor blood circulation due to blocked arteries. This temperature difference can be a warning sign that blood flow is compromised. It's essential to take this symptom seriously and seek medical evaluation. 5. Color changes in the skin. Changes in skin color, such as a pale or bluish tint in the legs or feet, can indicate inadequate blood supply. This discoloration is a significant sign that warrants immediate attention, as it may suggest severe arterial blockage. 6. Slow healing wounds or sores. If you notice that cuts, sores, or wounds on your legs or feet are healing slowly, it could be a sign of poor circulation due to blocked arteries. This symptom is particularly concerning, as it can lead to infections or more severe complications if left untreated. Ignoring these warning signs can have serious consequences, including the risk of critical limb ischemia, which can lead to amputation in severe cases. If you experience any of these symptoms, it's crucial to seek medical evaluation as soon as possible. Early detection and intervention can improve your prognosis and help maintain your heart health. don't hesitate to contact a healthcare professional with concerns about your leg health. Your well-being is worth it. We began by exploring 6 common medications that can potentially lead to severe heart failure. These included NSAIDs, certain diabetes medications, chemotherapy agents, antidepressants, corticosteroids, and specific antihypertensives. Understanding the risks associated with these medications is crucial for anyone taking them, and it's always wise to consult with your healthcare provider about any concerns. Next, we delved into the 6 warning signs of a heart attack. These signs, chest discomfort, shortness of breath, radiating pain, nausea or lightheadedness, unusual fatigue, and sweating, are critical to recognize. Early detection can be life-saving, so seeking medical attention immediately, if you or someone you know experiences these symptoms, is essential. We also discussed the symptoms of blocked arteries in the legs, which can indicate peripheral artery disease. These symptoms included leg pain or cramping, weak or absent pulses, numbness or weakness, coldness in the lower leg or foot, color changes in the skin, and slow healing wounds. Ignoring these signs can lead to severe complications, so awareness of them is vital for maintaining your overall health. The overarching theme of our video is the importance of being proactive about heart health. Regular checkups, open communication with healthcare providers, and awareness of your body's signals can significantly reduce the risk of severe health issues. Remember, your heart health is not just about managing existing conditions. It's about taking steps to ensure a healthier future. If you found this video informative and valuable, we encourage you to engage with us. Please subscribe to our channel for more health-related content. Like this video to show your support, and share it with friends and family who may benefit from this information. Together, we can spread awareness about heart health and empower others to take charge of their well-being. Thank you for watching, and remember to prioritize your heart health daily.